Hi, my name is Faraz and this is my mom. Today, I came to Markham Stouffville Hospital to have surgery. We got here 2 hours before my surgery time and went straight to the main reception to check in. My mom had to answer a few questions and then I got an ID wristband to let everyone know who I am. When we were done, my mom and I waited in the family waiting room. I brought some games to play while I waited. After a while, a nurse came out and called my name. Then I changed into special pajamas. My best friend Teddy came along. The nurse needed to see how tall I was, how much I weighed, so I stood on a scale. The nurse also checked my temperature, listened to my heart with a stethoscope, and checked my blood pressure with the cuff that hugged my arm. Then it was time for me to go to an exam room and get ready for surgery. I also met a lady called a child life specialist. She showed me a picture of the room where my surgery would happen. There is a bed that moved up and down that I would lie on. She was really nice. Next, we met with some doctors and a nurse. They wore special clothes called scrubs. One of the doctors I met was the anesthesiologist. This doctor gave me the medicine that helped me sleep during my surgery. The doctor told me that I would get my medicine through a mask, which he showed me. When it was time for my surgery, a nurse came to my room and checked my wristband. She asked me for my name and for my birthday. She also asked me what I had eaten last. It's safest for your body when you don't have anything to eat or drink before you come to the hospital for surgery. Then we left for the room where I was going to have surgery. We stopped and waited in the holding room to talk to a couple more doctors. Sometimes kids go straight past this room to the surgery room. When the nurse and I walked into the surgery room, I saw the bed that the child life specialist told me about. I saw some big lights. The nurse helped me onto the bed and gave me a blanket to keep me warm. While I was sitting on the bed, they put stickers on my heart and stomach. They felt cold and gooey. The anesthesiologist helped me hold a mask over my nose and mouth. They told me to take some deep breaths and count backwards from 10, 9, 8, 7, and I started to feel sleepy. After a few seconds, I fell asleep. This is the room where I woke up. It was kind of noisy, and I heard people talking and machines beeping. A nurse checked on me to make sure that I felt okay. If I wasn't feeling very well, the nurse could give me medicine through my IV. She told me my IV was a small feeding tube in my vein, covered up with tape. I got it while I was asleep. My mom was able to be with me the rest of the time I was in the hospital. I got to take a ride on my bed into day surgery. It was fun. They gave me a popsicle and let me watch on my iPad until the doctor or nurse said I could go home. My surgery was called outpatient surgery, which means that I got to go home. Sometimes after surgery, you may need to stay in the hospital. Thanks for learning about my surgery. If you or your family want to learn more, check out the hospital website at www.msh.on.ca.